Assalamu alaikum, Dr. Inam again. I have been coming to you again and again. I will try to continue my efforts to communicate to you about certain important aspects of the disease and healthcare. They are very beneficial. You keep on seeing them. Subscribe or not subscribe, that is not the issue, but you must see and forward it to your dear ones and the near ones. We have discussed before the CPRs and scorpion in ear and gunshot wound in the sternum. Today I will discuss about a case. I was posted from King Khalid Hospital to Hyle General Hospital, Hyle, for some time. When I was there, there was a patient who came with chest pain. He had minimal ECG changes, but while we were examining, we find that he was in hypotension, very low blood pressure, and he was tachycardic. When we did the ECG, it showed ventricular tachycardia. Soon the patient started gasping and there was no pulse, but the monitor showed tachycardia, ventricular tachycardia. So normally what we do is in such circumstances that either we give some drug like xylocaine, this thing, or once the blood pressure is not perceptible and we cannot appreciate even the pulses, then we give them DC shock. So we reverted that patient with cardioversion and the patient's rhythm came back, and I advised to give them 2.5 cc of 2% xylocaine bolus, that will be equivalent to 50 milligram, and then I told them to continue with 1 milligram per kg, 1 milligram per minute xylocaine infusion. But as we were planning to shift him to the department, because we had the power to shift them into the medical department or whatever care they have there at that time, then again he started gasping. Again we find that there was no pulse. We cardioverted again. Then again we gave a bolus of xylocaine, but this kept on happening. I wanted to get rid of him and send him to the ward so they will care, because I had many patients there. So this happened about 10 to 12 times. Whenever I would think that the patient should go inside and we were about to push the nurses and the ward boys to the ward, he will again start gasping. So we will do cardiac massage. If we could not find the pulses, we did do cardioversions, but this won't help. Again he will go into that. I was in a fix what to do, because we sent for electrolyte, because sometimes electrolyte imbalance can also cause this sort of arrhythmia. Basic cause was possibly ischemic heart disease, and blood pressure was falling and he was gasping again and again. Then I thought of injection bretylium. I never used bretylium before, and never after that. I asked for injection bretylium. It came with the name of, I think, bretylate. So I asked somebody, there was a nearby pharmacy. Luckily somebody brought that bretylium to me, and I just read because I never used that before. We gave him injection bretylium and then he was stabilized. And we kept him half an hour and the rhythm did not change. So this was a wonderful drug, but I don't know, this is no longer being used now. That is my first and the last case of injection bretylium. This controlled the rhythm of the patient, and the patient then was admitted into the Hyle General Hospital, and hopefully he recovered. And I asked about that patient. They said he is stable now, and ultimately they discharged him. This is the first time a patient with that much of arrhythmias and cardiac arrest, pulseless tachycardia. He didn't fibrillate, but he was having pulseless tachycardia, and he was not being controlled with normal routines. We had to give him shocks, but ultimately he was controlled with bretylium. So this is, I thought I must tell you, because this never happened in my life before, and I didn't use bretylium before, or even not after that. I think it's no longer available now, but I thought I must share especially the doctors about this, that sometimes you are in a fix. So if you keep on exerting, you keep on applying your knowledge or whatever resources you have, you can control that. Okay, Allah Hafiz. I will be coming with you for some Urdu versions also. Thank you very much. Assalamu alaikum.